The most common cause of ovulatory dysfunction-related infertility is polycystic ovary syndrome, which affects up to 1 in 5 women. PCOS is defined by 3 primary things. 1, irregular menstrual cycles. 2, lab evidence of elevated androgens, such as testosterone, and then ultrasound appearance suggesting polycystic ovaries. This means on ultrasound we might see a higher number of follicles or larger ovarian volume compared to ovaries that are not polycystic. PCOS is caused by multiple factors, partly genetic, partly environmental, partly metabolic, partly in utero during pregnancy when we were growing. So at the end of the day, environmental cues and environmental factors like nutrition and diet can significantly affect PCOS. Within PCOS, about 80% of women are either overweight or obese, and about 20% are quote-unquote lean, have a normal BMI. However, almost all women who have PCOS have some degree of insulin resistance. So the metabolic dysfunction is not unique to women who have a higher BMI. But all women who have PCOS, including lean, can be affected by irregular menstrual cycles, ovulatory dysfunction, infertility, bothersome hair growth. And so in the same fashion, I tailor the treatment toward those goals. When I meet you for the first time, I ask you what your top 3 PCOS related goals are. For some women, it's fertility. For some women, it's menstrual cycle regularity. For others, it's bothersome hair growth. For many, it's weight gain, prediabetes, or metabolic dysfunction. So we approach your goals according to what is affecting you and get a treatment plan together. A common misconception is that PCOS is a clear cause of infertility, and that isn't really directly true. It's the irregular ovulation that's causing infertility, and once that is corrected, you can get pregnant. One question that I commonly get is, well, doctor, can we cure my PCOS? And the bottom line is no, it's more complicated than just that. PCOS also originates in a center of the brain with a hormone called GnRH, and that GnRH sends a cascade of hormone signaling that eventually hits the ovary. And because we can't change the pulsatility of hormone in the brain, we can't inherently change your genetics and your brain's hormone production. But we can target your therapies toward improving ovulation to improve fertility.